sir. My name is Carly. I'm a nurse practitioner student from Oakland University. Today I'm going to be performing a cardiac and a GI assessment on you. Is that okay with you?
Mm-hmm.
Okay, I'm going to be starting with the carotid arteries. I'm going to be palpating carotid pulses with the pads of my fingers, first on the right and then on the left, one at a time. Then I'll be auscultating with the diaphragm of my stethoscope. And then with the bell, listening for any bruits. Okay, I don't hear any of those. I'm going to move on to the cardiac assessment. I'm going to inspect your chest wall first. I'm looking for any ventricular pulsations, which I don't see any. Then I'm going to palpate for the PMI, the point of maximal impulse. That should be at the fifth intercostal space, midclavicular line, which it is for you. If it were to be laterally displaced, that could mean you might have cardiomegaly, which could indicate that you need further testing for that. Then I'm going to be auscultating over the precordium. Again, first with the diaphragm, then with the bell, and I would do this both in the sitting and in the supine positions. Okay, so first I'm listening to the aortic area, the pulmonic area, second pulmonic area or valve, tricuspid area, and the mitral area, also called the apex. I would be listening for normal heart sounds, which are S1 and S2, as well as any irregular heart sounds, such as murmurs, S3 or S4. Then I'll be moving on to inspecting the skin color, looking for any pallor, any flushing, any cyanosis, which I don't see any. I'm also going to inspect your nail beds for clubbing, which could indicate chronic hypoxia. I don't see any clubbing. Also going to evaluate for capillary refill, where I push down and let go, and the blanchable color should return to a normal color within 2 to 3 seconds. Then I'm going to move on to palpating your peripheral pulses. I would do the brachial pulse on both sides, and radial pulse on both sides. At the same time, I would palpate your extremities, make sure they were warm, visualize the hair pattern, especially on your feet and your toes. If you didn't have any hair, that could mean you have poor blood flow. Then I would move on to your femoral pulse, which is in the groin area, and also the popliteal pulse, which is behind the knee. I would use both hands to palpate that. Then I would move on to the dorsalis pedis pulse. Okay, which is on the top of your foot. Good. And the posterior tibial pulse. And here is where I would also note your hair pattern. I would test the capillary refill here again, which is normal. And I would be checking for also any edema. You can normally visualize that around the ankles if there's any pitting, which you have none. So on this assessment, I did not find anything irregular. And I'm going to also now be moving on to the GI assessment. Thank you.